Namaste बेटिया, हमेशा खुश रहो बेटिया. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, JAIPUR. In this series of lectures, we are discussing about the various hepatobiliary diseases. And in the last few lectures, we have been discussing about hepatitis. Till now, we have discussed about hepatitis, the general introduction, and also we have discussed about the common features of hepatitis, the investigations and management. Then we have discussed about hepatitis A virus, and in the last lecture, we have discussed about the hepatitis B virus, its etiopathogenesis, clinical features, investigations, and management. Today, we are going to move ahead and we are going to discuss about the other type of viral hepatitis, that is hepatitis C, D, and E. So in today's lecture, we are going to discuss about all three of them. So let's start with hepatitis C, D, and E. So hepatitis C. Hepatitis C, it is caused by the RNA flavivirus. The onset of hepatitis C is usually insidious. So hepatitis C is caused by RNA virus. Basically, hepatitis C is an RNA virus and it is caused by the RNA flavivirus. The onset of symptoms of hepatitis C is usually insidious, that is slow onset with the incubation period of around 7 to 8 weeks. Around 2 months incubation period is present in the spread of hepatitis C virus. The age group that is most commonly affected by hepatitis C is any age group can be affected, but it is more common in the adults. So hepatitis C virus, the incubation period is around 7 to 8 weeks, that is around 2 months. And any age group can be affected by hepatitis C virus, but it is more common in the adults. There is acute symptomatic infection with hepatitis C is rare. So you will not see the acute exacerbation of hepatitis C virus, and it is recognized when the chronic liver disease has developed. So you will never see the acute symptomatic infection with hepatitis C virus, but it will be seen when the chronic liver disease has been developed. Previously, it was known as non-A and non-B hepatitis because it was neither A, it was nor B. Therefore, hepatitis C virus hepatitis was also previously known as non-A and non-B hepatitis. How does the spread of hepatitis C takes place? The spread of the hepatitis C virus is through the blood. That is, after a transfusion of the blood or the blood products or intravenous drugs or sexual or perinatal transmission. But an interesting thing that you are going to see in hepatitis C is the spread of hepatitis C virus does also take place through the sharing of the toothbrushes and razors. Therefore, it is said that you should not share the toothbrush because spread of hepatitis C virus can take place. So sharing the razors or sharing the toothbrush can also lead to the spread of hepatitis C virus. So it is spread after a transfusion of blood or blood products, intravenous drug, sexual or perinatal transmission, and sharing the toothbrushes or the razors. The clinical course. Most of the individuals remains asymptomatic until the progression of cirrhosis occurs. So when a patient is affected with hepatitis C virus, then most of the individuals remains asymptomatic. They do not show any of the symptoms until the progression of cirrhosis, liver cirrhosis has taken place. We have discussed in cirrhosis just a few lectures back that in the cirrhosis, we are going to observe two things. One, we are going to see the fibrosis, and the second is the nodule formation. So fatigue can complicate the chronic infection. So if a patient remains fatigued or tired, then it can complicate the chronic infection. The symptoms are clinically mild. So the patient will not have severe symptoms and the symptoms will be mild and are marked by the fluctuant elevation of the serum aminotransferase level. That is AST, likelihood of chronicity leading to cirrhosis. So hepatitis C, it is basically an RNA virus that is having incubation period of 7 to 8 weeks. It is having a slow insidious onset and it can affect any age group, but it is more common among the adults. The acute exacerbation of hepatitis C is rarely seen and it is usually associated with the chronic liver disease. And previously it was known as non-A, non-B hepatitis. The spread of hepatitis C virus takes place through the transfusion of the blood or the blood products, intravenous drugs or sexual or perinatal transmission, or the sharing of the toothbrushes or razors. In the clinical course, most of the individuals remain asymptomatic until the progression to cirrhosis occurs, and the fatigue will complicate the chronic condition of hepatitis C. The symptoms of hepatitis C are usually mild, and these are marked by the fluctuating elevation of serum aminotransferase levels, likelihood of the chronicity leading to cirrhosis. Now, in the investigations, what are the various investigations that could be done in case of hepatitis C infection? Anti-hepatitis C virus in the serum, that is, antibodies to hepatitis C virus can be seen in the serum. There are 6 common viral genotypes of hepatitis C that could be identified. The liver function test will show fluctuating serum transaminases. So the liver function will show fluctuating serum transaminases between 50 and 200 international unit per liter. The liver histology in the liver biopsy will be done to stage the degree of liver damage. So if we want to assess the degree of the liver damage, then in such case, liver biopsy can be done. And METAVIR system is a scoring system that is used in hepatitis C that scores fibrosis from 1 to 4 and the letter equating to cirrhosis. So METAVIR system is a scoring system that is used to score the fibrosis. Now, the management of hepatitis C virus. So if a patient is coming to you with the infection of hepatitis C virus, then we can give in the management pegylated interferon plus ribavirin, pelaprevir, and boceprevir. Liver transplantation is done with hepatitis C, almost always recurs. So if you are doing liver transplantation with a case of hepatitis C, then you will again get fibrosis and cirrhosis of the liver. In the transplanted liver, up to 15% of the patient will develop cirrhosis. Now, what is the prophylaxis of hepatitis C? No active or passive protection against hepatitis C virus is seen. So we do not have any vaccination for protection of the hepatitis C virus. So this is all about hepatitis C. Now we will come to the hepatitis D virus. Hepatitis D virus is also known as the Delta virus. The onset of complaints of hepatitis D is also insidious or acute. So the symptoms can develop slowly or it can develop at a very faster pace acutely. It is an RNA defective virus and it has no independent existence. So hepatitis D virus cannot go on its own. So it does not occur singly, but it always occurs in presence of the other virus. So it requires hepatitis B virus for the replication. Therefore, hepatitis D virus is always associated with hepatitis B virus because it requires the body or the genome of the hepatitis B virus for its replication and has the same source and mode of spread. So as hepatitis B virus was spreading through the sexual contact, through the vertical transmission, through the horizontal transmission, vertical from mother to child, and horizontal from in the form of needles, sharing the needles with the drug users, sexual intercourses, etc. So in the same way, hepatitis D virus is also affecting the other individual because it is spreading with the hepatitis B virus. Now, the chronic infection with hepatitis B and hepatitis D can occur, and this frequently causes rapid progressive chronic hepatitis and eventually cirrhosis. So the chronic infection with hepatitis B and hepatitis D virus can occur, and this frequently causes rapidly progressive chronic hepatitis and eventually cirrhosis will develop. The transmission of hepatitis D virus takes place by the close personal contact. As I have discussed with you just now, that just like the hepatitis B virus, its transmission is going through vertical and the horizontal transmission through the personal contact, percutaneous sexual transmission, and by vertical transmission from the mother to the child. The incubation period of hepatitis D virus is 30 to 180 days, the same as that of the hepatitis B virus, that a mean of 60 to 90 days. The investigations that could be done in case of hepatitis D includes anti-hepatitis D virus in the serum that initially has IgM and IgG. So initially IgM antibodies will be present, then the IgG will be present. Now, how to manage a case of hepatitis D? Effective management of hepatitis B is effectively prevent hepatitis D. So if we want to prevent hepatitis D from happening, then we can stop hepatitis B virus, and automatically the hepatic D virus will be stopped. So stopping hepatitis B, the management, the prophylaxis remains same as that of the hepatitis B virus. Now, so this was all about hepatitis B. Now we come to the hepatitis E virus. So we have discussed about hepatitis C, we have discussed about hepatitis D. Now we come to the hepatitis E virus. Hepatitis B is caused by the RNA virus, and its onset is usually acute. So we don't have an insidious onset in case of hepatitis E virus. The onset is usually acute with the incubation period. The incubation period is small. Usually it consists of 14 to 60 days with a mean incubation of around 40 days. So the incidence, hepatitis E virus is most commonly seen in the young adults between the 20 and 40 years of age, and the adults greater than 60 years of age. So hepatitis E virus, it is usually seen in the young adults with age group 20 to 40 years, and the adults greater than 60 years of age. The transmission of hepatitis E is same as that of the hepatitis A, that is the fecal-oral route. So it is enterically transmitted and is responsible for all the waterborne epidemics in the country. So epidemics that you are going to see in country is mostly because of hepatitis E virus. So the spread of hepatitis E and A is through the same way, that is the enterohepatic circulation. And most of the waterborne epidemics in India are caused by the hepatitis E virus. The clinical presentation and management of hepatitis E is similar to that of the A, as just discussed with you. But still, we are going to discuss the clinical features. The clinical features of hepatitis E infection includes malaise, myalgia, arthralgia. So we will have malaise, myalgias, and arthralgias in the patient. The patient will have GI symptoms like anorexia, nausea, and vomiting, and diarrhea. Diarrhea will be very common, and there will be a low-grade fever and abdominal discomfort. So in the clinical features of hepatitis E virus, the patient will complain of malaise, myalgias, arthralgias, with nausea, vomiting, diarrhea, and low-grade fever and abdominal discomfort. The symptoms usually precedes the development of the jaundice by a few days to 2 weeks. So first these symptoms will develop, and then the jaundice will develop. It is followed by dark urine and pale colored stools with jaundice and tender hepatomegaly. These symptoms are common with all the varieties of hepatitis. It can be subclinical. So the presence of these symptoms can be subclinical and can be detected on the basis of elevated aspartate and alanine aminotransferase acid, that is AST and ALT level. The symptom will last for around 3 to 6 weeks. And then there will be a recovery within 6 to 12 months, and it is usually with no clinical sequelae. So in the hepatitis A, it is caused by RNA virus. The onset of hepatitis E is usually acute with the incubation period of around 40 to 60 with mean of 40 days. The incidence, it is more common in young adults and adults. The transmission is through the fecal-oral route, same as that of the hepatitis A virus, and it is responsible for maximum epidemics that you are going to see in the country. The clinical features includes malaise, myalgias, arthralgias, nausea, vomiting, and diarrhea with low-grade fever and abdominal discomfort. These symptoms usually precedes the development of jaundice by few days to 2 weeks. And it is followed by the dark urine, pale stool, and jaundice with a tender hepatomegaly. The symptoms can be subclinical and detected on the basis of elevated level of AST and ALT. And the symptoms will last for around 3 to 6 weeks. The recovery of this complaint takes place within 6 to 12 months, and it has no clinical sequelae, means the patient is not affecting again with it. Now, how can you investigate it and what are the management? So investigation and management, it presents as a self-limiting acute hepatitis. So infection with hepatitis E, it is usually self-limiting, and that means the disease gets treated on its own after some time and does not cause chronic liver disease. So because it is an acute onset, it is having an acute onset. So in most of the cases, it gets treated on its own and it is not progressing to the chronic stage, that is chronic liver disease. Hepatitis E differs from hepatitis A in the infection during pregnancy. It is associated with the development of acute liver failure, which has high mortality rate. So during infection, if an infection is occurring during pregnancy of hepatitis E, then it will lead to the acute liver failure and it will have a high mortality rate. In the acute infection, the patient will present with IgM and antibody that is present. So we have to check for the IgM antibody to hepatitis E virus. This is positive. And now how to prevent the epidemic of hepatitis E virus? So we can give hepatitis E vaccine. The name of the hepatitis E vaccine is HEV-239. That could be given to prevent the patient from getting affected by hepatitis E. So this was all about hepatitis A, B, C, D, and E. So in these lectures, we have discussed about all the different 5 types of viral hepatitis. I hope you must have understood these sessions properly. Now it's your homework to go through the e-notes and to answer the question that are given in the e-notes and on the portal. So I hope you have understood this session properly. This session is powered by Digital Version 2.0, JAYOTI VIDYAPEETH Women's University. I hope the session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve that. So this was all for today. Thank you very much. Have a good day.